All right. Hi, everybody. Good morning. Happy Friday. Welcome to Manifold's Healthcare Pulse Speaker Series. Today's topic is digital health investments, addressing patient pain points and enhancing healthcare delivery. My name is Michael Korslin. I'm a digital health entrepreneur in residence here at Manifold and also lead our finance team. I will be your host today. Before I introduce our guest speaker, I just want to point some things out with regards to our, our Healthcare Pulse community. The series brings together healthcare executives, industry experts, and thought leaders to discuss and share knowledge of the latest innovations and trends in healthcare and to surface opportunities and challenges that lie ahead. That group now includes all of you joining us today, and we'd love for you to participate in today's webinar, and I'll show you how in just a moment. But first, I'd like to introduce you to our very special guest today, Dennis Depenbusch. Dennis is the Director of New Ventures Initiative at Blue Cross Blue Shield of Kansas, where he oversees the development and strategic investment of a $50 million venture capital fund. Dennis is also the president and a board member of the Mid-America Healthcare Investors Network, which is a nonprofit organization fostering connections among Mid-America's top healthcare VCs and private equity firms. Prior to holding these positions, Dennis also held various leadership roles in health tech and entrepreneurial endeavors. So he has a helpful operator perspective as well. I'm so excited to chat with Dennis today. Not only is he a VC, but he's a digital health VC. And not only is he a digital health VC, but he's one that has the unique insights of both the perspectives of a payer and a former entrepreneur. And on top of all that, and I didn't clear this with Dennis before our webinar today, so I hope it lands okay, but Dennis is also a connoisseur of Kansas City style barbecue. So we'll be sure to ask him for his recommendations on where to get the best Kansas City ribs before the end of the hour as well. Dennis, thank you so much for being here with us today.
Yeah, thank you. Thanks for having me. It's been a pleasure building up to this online broadcast.
Absolutely. Dennis and I, by the way, saw each other at the Vive Healthcare Conference this past week in Nashville as well. So great to continue the conversation. The agenda today, everybody. So we're going to be touching on a few topics with Dennis. Primarily, we're going to touch on the investment thesis at BCBS Kansas, what influences that investment thesis, and then Dennis is going to share some primary examples of that investment thesis in action. We'll also touch on Vive 2023, the event that Dennis and I were at, in Nashville this week. And throughout the conversation, we'll also be touching on scaling high growth teams and enterprises, as Dennis has a lot of experience in those areas. Before I toggle over to the cameras, I just want to note that the chat is now open. So please say hello, ask questions. Dennis and I will keep an eye on that throughout the conversation, and we'll make sure to address the conversations and questions as they pop up. Toggle over here to the camera. All right, Dennis, let's go ahead and kick this off. Before we get into the investment thesis at BCBS Kansas, would you mind sharing with everybody a little bit about your background and how you wound up in venture capital, and specifically digital health venture capital with one of the prominent payers within the country?
Sure. So traveled the world and came back to Kansas. So you can start the Wizard of Oz jokes now. There's no place like home. I got it all. I sort of cut my teeth on fintech before it was actually called fintech, and helped a company raise money in Central Europe, lived in Central Europe, and was part of a dynamic team that ended up taking it public. So, the short history, 4 startups, 2 went public, 1 did okay, 1 was a dumpster fire as an operator. And as I migrated from fintech into healthcare software, into IT, I started to have a better perspective and appreciation for healthcare in general. Once I cycled out of those entrepreneurial endeavors, this opportunity presented itself in Kansas, and we had just moved back to Kansas to help finish raising our 2 boys. So they got to know their grandparents and got to appreciate Florence, Kansas. And so this opportunity was presented to me through contacts, and it's like, we're looking for an entrepreneur. We're looking for someone that knows how to raise money and how to interpret opportunities and to feed those opportunities into Blue Cross of Kansas. And so I said, I know about all of that. I just don't know how to manage a fund. And they're like, you can learn that. Why don't you give it a try? And that was 7 years ago.
Wow.
Since that time, we've made 21 investments, 17 are currently under management. And the thesis, and it's been a super experience. As a former operator, at least I can sort of look through the windshield with my CEOs and know what's ahead, and also know what's realistic as far as from a growth perspective. It's not that a venture capitalist with a complete commercial perspective is not helpful, because they are. But it's also someone that can sit in that room and say, okay, we're probably asking too much because the logistics of getting there is just too difficult, or we need to reset our expectations.
Sure.
To make that happen.
I bet those operators appreciate that perspective. Just knowing that you've been there, done that, I'm sure it's got to be tremendously helpful to them.
Yeah, and it's great. It's psychology, coaching, business management, all of that together, and so you can apply your previous skills into an existing challenge.
That's great.
So,
yeah, Dennis, thanks for sharing that background and how you wound up in your current role with BCBS Kansas, and and did that also I imagine that also prompted you to join MHIN, the Mid-America Healthcare Investors Network, and lead that organization as well. Is that right?
Yeah, I for us, at least, Blue Cross of Kansas, and I'll explain our thesis here, and then that plays into MHIN. You know,
Okay.
we invest in companies that improve the health markets in general, are strategic to Blue Cross and Blue Shield, which usually means a vendor relationship is in target, but maybe not closed yet, and then provide returns. And for a corporate venture capital investor, most of the time you have what we like to call a double bottom line. You know, A, will it pay us back? And B, will it provide us strategic value?
Okay.
So in sourcing deals, I source through commercial venture capital partners because our team isn't that big, and we really don't want to or like to lead deals. Why is that? We don't have a deep enough team. We'd rather have another commercial venture partner with a deeper team manage the corporate hygiene that goes around managing a early stage growth company. And then I can go to work on business development. You know, there's 34 Blues plans around. If it works in Kansas, what sort of statistics and satisfaction measures do we have to come up with that company we've invested in to refer them to other Blues plans? And so or other payers in general. So that's kind of what we do.
Gotcha. So MHIN, correct me if I'm wrong, but consists of roughly 50 Mid-America healthcare investor groups,
Yeah.
VCs and
So
PEs?
there's 50 venture investors, and our thesis in the middle part of America is you only do deals with people you know and trust. On both coasts, you can sort of stumble out of a coffee shop and bump into an early stage company or another venture investor. It's unlikely that's going to happen in Kansas City or Cleveland or Chicago. Chicago, you might have a higher probability, or Columbus or Dallas or Atlanta. And so we have these forced events that we can all get together and talk about what's up, share deals, get to know one another, and do deals together.
That's
and
great.
So I joined the organization, then I ended up becoming president, and we have just a superb board right now that's super involved in creating events around sharing intelligence. And so, when COVID hit, we're on the phone. When Silicon Valley Bank takes a little slide, we're on the phone together and sort of sharing our learnings and our best practices,
Neat.
And just keep going down the road.
That's great. So the MHIN network is really strategic, to your point earlier, especially at BCBS Kansas, because of the I guess the narrow team that you have at BCBS Kansas gives you the opportunity to source deals and partner, syndicate with these other funds that exist throughout the geography.
Yep. Correct.
And Dennis, you're mentioning also it kind of ties in with the investment thesis in general. Would you mind elaborating a bit on the BCBS Kansas investment thesis? I know you mentioned the double bottom line. You're looking for ROI, but also the strategic benefit of the investment as well. Would you mind elaborating on that a little bit for the audience?
Sure. So we have 5 strategic pillars, and none of them are probably surprising. Better member engagement, being there when they need us, saving money on medical costs, all of those themes. And my job is really serendipitous to when these opportunities are presented, usually from an investor network. People say, hey, Dennis, what, would this work with a payer? And we'll work with that company to understand what solution they're providing and whether or not they fit into that solution, and then present them to our corporate leaders, and to give us an answer as to whether or not this solution or tech-enabled company solves the problem that they have right now and ties into their compensation or their motivation to solve that problem. So,
gotcha. And Dennis, along those lines, any specific challenges or opportunities that you've encountered along the way of, I guess, making that investment thesis, come to life?
I think the longer I'm in it, the better I get to understand our corporate leaders' expectations and motivations.
Okay.
Sometimes you get personally in love and tied in with these companies, and sometimes that's not the perspective of the people you're trying to have enable this technology within the organization.
Sure.
So those are, I guess, for me, there are hundreds, if not thousands, of opportunities for payers to improve themselves. And so you just have to sort of let that one go and then bring it along. And it's interesting also as an investor, and I need to come up with the statistics on this, because not every one of our portfolio companies are now vendors to Blue Cross of Kansas.
Okay.
Some were strategic plays that we wanted to better understand a different market, for instance, workers' comp. And so we made an investment to understand how those solutions are trending versus how the healthcare, the payer network is trending.
I see.
In other cases, we invest, we think we're going to be a good vendor to this company, and this company finds other opportunities, be it direct to consumer or wow, we really have a lot of payers asking us to serve them. What do you think about that? I think, God bless you, and move on. It's really hard to sell to the payer world. It takes a long time. And if you have a brighter future in another market segment, move on, so that you can be successful. And then we generate revenue and maybe not strategic returns.
That makes sense. So I wanted to dig into a little bit into something you just mentioned, Dennis. You said it's hard and it's a long sales cycle to sell into the health plans themselves. So some of these entrepreneurs are finding opportunities in health plans outside of BCBS Kansas. You're saying, hey, go for it. That's great.
Right.
Could you touch on a little bit more about what those challenges are selling into health plans, or what are health plans looking for? I know, for example, at Manifold here, we've started digging into star ratings, at least for Medicare Advantage plans. And I know that doesn't cover, all the health plans, but, we've learned that star ratings at times are top of mind for some health plans. But is that true, I guess? And what other priorities are top of mind for these health plans when someone's selling into them?
Yeah, if it's Medicare Advantage and it has a stars disposition to it, improvement disposition, there's great interest because your reimbursement is based on those stars. So if you're a 4-star plan and above, you're getting the maximum reimbursement that Medicare can provide. So Medicare Advantage, in essence, is value-based care. And if you're providing those values around those stars ratings, then you're cooking with gas, as they like to say. And if those stars ratings start to slide, you're out looking for a solution that will help you recover those stars. But I mean, if you lose stars, you have an 18-month crawl back to get that star back. So
really? Okay. Yeah, I remember I guess Q4 2022 was it, where CVS Aetna lost I think it was their 5-star rating, and I think CVS's market capitalization dropped by something like $10 billion as a result. So to your point, I mean, maintaining those star ratings is critically important. But there's an 18-month clawback where if they remedy the situation, they can.
Yeah, you have to earn it back.
You have to earn it back.
So if you think about it, it takes a year to earn it back. Your stars are usually lost in a 3-month period post.
Okay.
So 3 months plus 12 months plus probably another 3 months for them to decide you're better.
Oh, geez.
That's a long time.
Sure. Oh. Do you look for, like when you're looking for companies, when you're sourcing deals into the New Ventures initiative, do you keep an eye out for companies that are impacting stars?
Yeah, if they're serving the Medicare market, yes. That would be one thing. There's so many other aspects to Medicare or the commercial business that you can also look at, which is customer satisfaction. It could be medical cost savings that doesn't necessarily affect stars, but makes a bigger difference in the member experience. And our chief marketing officer, Mike Garish, is sort of turning the lens on, it's okay to make, as a member, you're normally just happy no matter what. You have a card, it works when you go to your in-network provider and you get reimbursed as expected. Those are all good things, but are we really there when our members really need us? And so if you think about it, what sort of support system are we providing to someone who has a child that gets really sick, or a cancer diagnosis, or end-of-life decisions and things like that? How can we be there better to serve our members?
Gotcha.
And so that's a big pole in the tent that you have to think around. But that may not even affect stars. Sure. It kind of will, because member satisfaction is a big deal.
Okay.
But to be there in a member's greatest time of need is that's a double bottom line right there. We're going to make more money because we're going to make people happy, and we're going to be there when they need us.
Dennis, would you mind sharing 2 to 3 examples that you've come across within your, whether it's just deal sourcing in general or a specific investment that you've made that has tied back into those ultimate goals, the strategic goals? Would you mind sharing, like, I don't know if you can, like the company name and what they do and how it ties back into that investment thesis?
Sure. So one company we've invested in that we utilize around behavioral health is called My Resource, and we like to call it Match.com for mental health. So in the last mile of searching for a therapist, you want someone that aligns with your values, is capable of treating whatever malady that you have on a behavioral health basis, and you feel will connect with you. And so that search tool allows you to decide, do I want a male? Do I want a female? Are they Christian? Are they Buddhist? Are they whatever? Are they agnostic? And how does that match up with a person that's middle-aged and depressed?
Gotcha.
So that's what we do. So I think there were a couple of questions too. Medicaid, Blue Cross of Kansas is just entering into a partnership with Medicaid. So we're not in there yet, but population health obviously has a big impact, and we will be in there with a partnership with Anthem in 2025. 2024 is probably, because the bid's due at the end of this year. So, but we do care about that, because with a population of 3 million people, that's pretty consistently stagnant. People cycle in and out from Medicaid to exchange to fully insured group. So this isn't a new population that enters our market. Normally, it's the same people. So we want to take care of them in every way that we can. And we actually have a group called Blue Health Initiatives inside Blue Cross of Kansas that focuses on those social determinants of health, particularly because we all know that 80% of your health isn't you just showing up at your primary care physician. It has to do with whether or not you're in a safe community. It has to do with your schools. It has to do with your access to food and transportation and education. And all of those make a difference. So, and that one of our early stage investments we made with Blue Health initiatives in mind. It was a group called Healthify, and they were a social determinants of health search tool to help enable our community health workers to find those services within and outside their communities.
Okay.
In studying social determinants, access to transportation, health, everything else, most of our community workers were using a Rolodex or an Excel spreadsheet and referring to people really in the county silo, because that's how we think. We think within our geographic bounds. Some of those interesting solutions that came out of Healthify was, oh, I live in Lawrence. Lawrence is 20 minutes from Topeka. That's not far to drive when you live in a rural area. And they're like, oh, I didn't know that there was an autism support group in Topeka, and I live in Lawrence, and now I do. And now I can come over and access that support group or that specialist that I didn't know existed, because Lawrence and Topeka are in two separate counties. And so you discover these things across the state and satisfy people in need. And, social determinants can't, just using the autism support group example, I mean, it doesn't matter if you're full income or on Medicaid, you may need that service.
Sure.
So, and they were bought out, and we had a nice exit. We're still a client in some cases, and
great.
That was a double bottom line improvement.
And so Healthify, Dennis, that's a great example. So you're saying a family that lives in Lawrence as a user of Healthify, who's unaware of autism support groups, now has access to a suite of services that are available within a certain radius, 20 miles or so.
Right.
And how do they access Healthify? Is that something like that the BCBS Kansas will let their participants know, like, hey, here's a new vendor or an app that we work with that could be helpful to you? Or how does it integrate with the user themselves?
Yeah. So Healthify really is an extension into where people usually want to access services. So in most cases, this is this is in community health workers' hands, not really on our website,
Okay.
because people seeking these services, we want to be where they are. And we learned, interestingly, that librarians are asked about services like this. So why don't we make the HealthFi tool available to librarians? I mean,
Wow, that is great.
find where these people in need are and how we can extend our services.
That's so interesting because you wouldn't think of librarians as a traditional channel partner for a healthcare company, but that just goes to show you got to really think outside the box. And to your point, you have to meet the patient and their families where they are and where they're seeking support. That's a great. I love that example.
Yeah, and so that's been just it's a super tool. It's super satisfying to make a difference with your own population on doing things like that. The other one that's inside our website but offered to every member of the state is my resource.
Okay.
So that just plugs in, and that's surprisingly is our greatest, our most engaging tool on our website ever.
Really? Wow.
And so the interesting part about having tools like this, like HealthFi and my resource, is now you know what people are needing too. It's like, how often are they using services? How often are people in search of food? How are people in search of mental health resources? Are these teenagers? Are these adults? Are they males? Are they females? Are they depressed? Are they schizophrenic? Are they suicidal?
Yeah.
And now you can sort of treat the disease, not the symptom, because you know where that is. So, for instance, in Kansas, we will probably always be under-resourced in behavioral health. But if we know that we have a screaming need in the teenage population, then we can treat that on a targeted basis rather than let's just throw a bunch of providers at behavioral health, because we're seeing, claims and everybody
Got
is.
it. Okay, so and through my resource, so the channel there is through the website, through the BCBS
Right.
Kansas website. So a BCBS Kansas participant logs into it, searches for it, finds it.
Yeah, go
Anybody.
to bcbsks.com and then
Okay.
search for behavioral health.
Gotcha.
Services.
Okay. Interesting. And as they enter their needs, that like you were saying, that gives you the ability to meet those needs in a more specific way and get away from a more generalized approach to behavioral health.
Yeah. And, one opportunity that we identified straight away is for kids. And we found a company called Manatee Health. And Manatee provides family behavioral health services on a very prescriptive basis. So their results, when you become a Manatee customer, and you can look it up and become a private pay customer today, when you engage with Manatee, you engage the entire family. And 85% of patients that sign up have completed 5 family activities a week after 6 weeks of using it.
Wow.
And a very consumer-driven, behavioral health-driven team there that measures NPS all day, every day, to make sure that your experience is good and satisfactory and points you in the right direction in a very distressed situation. The other advantage for Manatee that we worked out with them, and this goes to the double bottom line as well, is they are extending fellowships through their professional behavioral health. So their licensed therapists will have a fellowship or a participation for new graduates to shadow them and to follow the Manatee behavioral health treatment modality
Okay.
so that we can increase the amount of family therapists that we have in Kansas under the Manatee umbrella. And if they don't have enough volume in Kansas, they can serve other Manatee customers around the country.
Interesting.
So,
Geez, that's incredible. The level of engagement that Manatee has that you mentioned. You said on average, 5 family visits per week for the first.
Yeah. So they don't have to be visits with the therapist. Sometimes they're with a coach. Sometimes it's just journaling for the child to just journal and then whatever disposition they're trying to treat, they have the family do something together and then report back to the therapist. So I think they're leveraging a therapist's time to reach a super outcome for that patient.
Great. And Dennis, just to touch on one of the comments that you mentioned earlier, going back to the investment thesis, RJ's asking, what are your top 3 investment theses / themes for short-term impact that you're most excited about?
So I don't know if any of these are short term. So let's go back to a payer's buyer behavior, and then we'll get into short term impact. Behavioral health, definitely. I mean, it's a high need, and you can make a difference fairly quickly with some of the solutions that we've identified. But the buying behavior of a payer is pretty difficult in that there might be an RFP process. You need to satisfy your medical directors. How is this satisfying our medical loss ratio? Bring this in. Is there a satisfactory data and clinical set that makes our professionals happy? Because we're, any payer's a risk averse world, because that's what we do, manage risk. So, and then if it has an IT component that integrates with us, is the IT security holding up, not only from a PHI perspective, but also from security. Well, if we open up an API, is it secure? And will our firewalls prevent any type of attack from that vendor? So all of that's going to take time. And even if we're in a hurry, and then we'll enter into that vendor contract. So, short-term tips, don't have it integrate with our IT, make it pay off really fast, and be creative enough to enter into our market. So
great. Thank you for that. And then John Sfiocco's got a couple questions here too, Dennis. And related to, to all this digital health investment that we've seen over the last few years, post, or during or post COVID, obviously the VC investment in digital health has skyrocketed. It's come back down in recent months or quarters, but how do you keep track of all that? Or how does BCBS Kansas, how do payers keep track of all that? Even if you have all this investment, I imagine it must be somewhat overwhelming for a payer to manage all of these. I guess it kind of comes back to RJ's question as well. If you have all these digital health solutions coming to you saying, hey, I can solve a problem and I can integrate, or I may be able to integrate, but you need to really kind of validate all that stuff, I imagine, as a payer. Is that right?
Yeah, that's right. You have to validate all of that. I think, just like going to the Vive conference, you sort of filter it through your colleagues. So the Mid-America Healthcare Investor Network, we're also limited partners in the Blue Venture Fund, and the Blue Venture Fund is 32 Blue plans that formed their own venture fund and have our venture fund managers serve us and helps us source those deals, do what you said, the deal intelligence, and then decide on what's the relevant solution. When you look at all of these digital health tools, it's a really messy world now. So sometimes you have to wait for the market to self-select who the winners are. So as a payer, you have to be very careful that you buy into a winner that's going to be around for a long time, or you're standing up a tool that goes bankrupt. And that's not good either. And it's really hard to simplify. So if you have a diabetes digital tool and you have a depression digital tool and you have a hypertension digital tool, it complicates your world more than simplifies it. So you have to look for the highest and best opportunity and hope that you can build a strategy around it. Just think behavioral health. We have to be very careful on what solutions we provide so that our front door is easy to open up, and then look at the landscape through that door and be able to choose what's relevant and important to you as well. So if you open the door and the closet's full and disorganized, you're going to close the door and say, it's too complicated for me. And that's kind of how you look at it as an investor too. I mean, payers intentionally, some payers jumped straight into telehealth. Some of them took a step back and said, okay, I can't pick a winner because it's too complicated.
Sure.
And this is back in the teledoc days. Going to wait for the market to shake itself out in order for us to make a commitment to a winner.
That makes sense. It's got to be organized for that end user. John was also asking, Dennis, you can see the chat there. He was asking about AI tools such as ChatGPT and large language models. Is that influencing your theses at this point at all? And if so, how?
Yes, it is, and no. So the yes part is, any robotic process that we can add to our back office is going to make us more efficient. So some of those tools that don't involve patient touch are probably going to be enabled better and faster than those that touch patients. And part of that is ensuring that our digital outreach has some sort of quality control metric around it. So there's hesitancy to let that system operate on its own in patient care. But I would see like automating pre-authorizations for medical care move through that system faster than reaching out to a patient and asking them how they are.
Gotcha.
But all of that, we're at the front end of that, and we're probably in the hype cycle right now. And so we're going to have to see where it all settles out before we jump into it. But that, AI, predictive analytics, all of that has great relevance to plans. And those that are building a plan around that next generation tech will be the next market leader.
Gotcha.
Because they'll probably be more efficient in delivering a product. But on the other hand, when you think about it, the payers operate at a pretty thin margin. I mean, and so it's funny when we automate all of these things, we may take 1% or 2% out of a 5% cost, 5% profitability. So does it matter? Yes. And it needs to, but where are the savings and where's the satisfaction for the member, which is paying the bill, or the corporation? And finally, self-insured corporations have really started to take a leading, I'd say, edge on all of this, because it's really expensive to insure people these days. It's, I saw a statistic that just for members, it's 33% of your household budget now is healthcare when you add premiums, co-pays, all of that. And it's almost at that level for corporations too. So, so somewhere in the healthcare delivery system, something has to break or get more efficient. And maybe that's all the way down at the provider level. And how do you do that and still keep providers profitable enough to provide great care? So there's your tension.
Yeah.
We need to save costs, but we can't have our providers go broke. So how do you balance that?
I know I've heard a lot lately from providers about the healthcare workforce shortage. And I know what you're saying initially here, the near term opportunity for GPTs and LLMs is that it could help with maybe back office efficiency, but you're saying maybe further, down the road, it's more of a strategic element. And I guess as it gets more credible in terms of its ability to engage patients, do you think it ever could help solve some of that healthcare workforce shortage by engaging with?
I would think so. I mean, the inefficiencies in data exchange, the inefficiencies of an admission to an ambulatory hospital is, there's a lot of inefficiencies there that maybe ChatGPT could solve.
Yeah.
So that that health record could be made and maintained either through ChatGPT or in a provider's data warehouse, and then that interoperability between providers is going to be a bigger challenge, just to save costs. Which is, do I know enough about the patient in order to have an actionable result? And then we're just not good patients in America. We're not very compliant. Sometimes we don't take care of ourselves the way we need to.
Yeah.
And we feel that the system should take care of us no matter what. And so there's a cultural element that we need to understand, because, we're not Swedes. We're not from Iceland, I guess if we were and we followed their culture, we'd be cheaper patients, but we're not.
Yeah. Taking care of ourselves more on the front end and engaging in more preventative practices than addressing the symptoms on the back end.
Yeah, because virtually every health app works if you stay on it.
Sure.
And so I think the secret formula is finding those opportunities that truly engage patients to make a difference in their own health outcomes. All of them work, but not all of them bring mass engagement. I mean, particularly digital tools. If you reach 2 or 3% of your affected membership, you're an all-star app, right? But that you still have 97% of an affected population that is not engaged. How do you engage them?
That's such a great takeaway. I think for what I'm hearing you say for all digital health entrepreneurs is we all got to focus on engagement, and it can be an app that works, but if there's no engagement there, then it's going to fall flat.
Yeah, and it's really difficult. Providers aren't superb marketers, payers aren't superb marketers, and now you have a digital health tool. Hopefully, they're a superb marketer that has enough imagination to engage our members, which is why we were so happy about Manatee. I mean, first of all, there's people raising their hands that need pediatric behavioral health, family-based. And then second, they're engaged and they stay engaged. That makes us super happy for our members and for the company, and as an investor, very super happy. So those are fun things to walk away with.
Pivoting a little bit, Dennis, back to Vive and what we saw there this week. I know, one of the first sessions I went to was a Medicaid session on Monday morning from 10 until noon, and so many subject matter experts in the room. And entrepreneurs and investors that, and they really did a great job just collaborating the session. I mean, they had some opening comments for the first maybe 30 minutes, but then put everybody at tables and forced collaboration and Q&A amongst those tables. But I'm curious, what were some of your most interesting takeaways from Vive? Just maybe 2 to 3 that just really stood out for you, as you're keeping your finger on the pulse of this.
Yeah. I would characterize the conference as subdued, and I think it was just external factors on it. It didn't feel like it had the energy that it had from previous Vive sessions. Not a knock on the conference. Those guys and gals put on a tremendous conference. Very well served for those that are paying fees to go to it. But it seemed like people were more intentional in making decisions. The Medicaid conference, all of the things that are around Medicaid are fascinating now. And it seems like what's old is new again. We've seen a lot of tech offerings that said, hey, we're going to send health workers into a Medicaid recipient's home to do health and wellness checks. And we're seeing this bend the cost curve. And it's like, that's interesting. We used to call that a house call, 50 years ago. All of a sudden, old is new again. We're just leveraging it with technology.
Yeah.
And so what comes around goes around, I guess, with that. But I'm super excited to see this many new innovations come around to Medicaid, to those recipients, and to solve some pretty significant population health problems.
Yeah, that was a vibrant session. And it set the tone off, or set the tone of the event off on the right foot for me. I was really impressed with it. I had missed prior years, so I'm not as plugged into what that Vive was 1 year ago or so, but I imagine part of what you're saying is just due to over the last 12 months, venture investment in general has just come down with rising interest rates. And do you think that's driving part of it? Just it's a little bit more subdued because of that macro environment?
Yeah, I think it is. I think we're sort of in a right sizing environment. And if it wasn't Silicon Valley Bank, it would have been something else. It's kind of a natural progression when you think you have all of these digital tools searching for a need. And if you have too many digital tools, you run out of market. And so, and I think that's what we're seeing is, I remember being in the ophthalmic space and talking to a venture capital investor that said, I found something that solved glaucoma. And they're like, okay, stop. You can't do that, even if you cure glaucoma. And it's like, what do you mean? He says, well, look at the backlog of glaucoma solutions and look at the sponsors of those solutions. It's going to take 5 years to work through all of these solutions in the market before they're going to even look at or consider the next one.
Wow.
So it's sort of supply and demand. And I think that's where, if you have 250 digital health solutions that are solving diabetes, you probably only need 20. Yeah. So where's that going to shake out?
Interesting. Jeez. Well, and Dennis, too, there's one particular, I guess, investment thesis and action story that you've shared with me, the last couple of times that we've met, just considering some of the things that we're doing, inside Manifold at Lots of Helping Hands. You shared a story about a company called Advocacia, which is Chicago-based and working in the Medicaid space.
Yep.
Would you mind sharing that with the audience a little bit? Because I think it's just it's a really fascinating story, just in terms of how you were able to connect with them and help them springboard into this new territory that they're now in.
Yeah. So we sponsor Community Health and Vibrancy Summit in Wichita And I should have known the event, but if you go nxtage.io, nextstage.io, it's around community health and vibrancy. So we bring in community leaders from around the state who also we pre-select themes around what they need. And then we deliver those. We deliver technology companies. They go out and search the world. And we've had every continent. I think we've had 400 companies over 2 years apply. And we've taken maybe 20 of them from all around the world, except for the Arctic. Nobody applied for the Arctic. And then we bring them in. And Advocacia was one of them. And one of our community partners called Thrive Allen County got a grant from CMS. And through the grant process they were writing for Advocacia, CMS became super interested in what they were doing. And Advocacia basically is a technology solution that allows people in need to apply for Medicaid and other things like SNAP grants. If you need Medicaid, you probably need something else. And they have that database that allows you to enroll in all those programs. So they won in Allen County. They were invited to CMS in Washington, D.C., just as the result of this. And now Advocacia, Thrive Allen County wrote a grant for the entire state. So Advocacia is now running in the state of Kansas, serving our Medicaid recipients.
That's such a great story.
Yeah, it's a feel-good story, and they're great entrepreneurs at Advocacia, and really love serving them.
Yeah, I know you've introduced me to Laura Robbins over there, the COO, and I saw her at the Medicaid sessions, as I mentioned to you at Vive, and she and I are going to be connecting here in early April. So yeah, thanks for sharing that. I always love that story, and glad you could share it with the audience here too.
Yeah, you never know what's going to happen when it's just making the referral and helping others out, because it'll come back to you.
Dennis, any parting comments? I know we're kind of coming up on the hour here. Any parting comments or advice that you would have for any of the audience members from a digital health entrepreneurship perspective, or even intrapreneurship perspective, if they're working inside an enterprise that is working towards innovative solutions?
Yeah, boy, those are big challenges. Entrepreneurship is a sales job in and of itself. You have to keep your internal customers happy and aware of what you're doing all the time. And it's sort of like being a CEO. You always forget, as you're growing your team, that you need to communicate your vision and culture all the time. And so it's selling up and down the organization to ensure that you're serving their needs adequately, or you won't last. On a macro level, it's we're back to value again, which is, are you being efficient with the cash that you're being given, and can you make it last a really long time until you get the revenue formula correct? Which means, is your value proposition right? Are you treating pain with an aspirin, or are you providing a supplement that just makes you feel good?
Yeah.
And hopefully you're treating pain with an aspirin.
Yeah.
And how do you deliver that sales solution to your customer in such a way that it shortens your sales cycle and increases your volume?
That's great. So pain points and have the right channel, which, to your point earlier in the conversation, I still love that librarian example.
Yeah.
That was Healthify, right?
That was Healthify. Yeah.
Yeah. So to your point, hit on a pain point, get the right channel partners. And then I think you also mentioned midway through the conversation, the importance of just sustained engagement, like Manatee. If you can hit those three things, your odds of success are much higher. Is that fair?
That's fair. Listen to the market.
Yeah.
And hopefully it will lead you to success, or fail fast.
Sure. And failing fast is not the worst thing in the world, right? I mean, success is the best outcome, but if you're gonna fail, the idea is kill the idea as soon as you possibly can, right? Because you want to avoid wasting time and resources on something that ultimately is not going to go anywhere. So then you can just bring the next idea up and get running on that, right?
Yeah. Yeah. There was a question. Do we have enough time?
Yeah, absolutely.
When evaluating an opportunity, I mentioned corporate hygiene. Can I explain that a little more? So corporate hygiene basically is the ability to put projections, board books, investor communications out and put it out in a satisfactory and an iterative process that makes your investors happy. And you should start practicing that the minute you start your company, even if you don't have a board, even if you don't have investors. If you expect both of those, it's a worthwhile endeavor. And even when I was running companies, putting that board book together was time consuming and hard, but it also provided some mental and emotional perspective on whether or not I'm going in the right direction. And if I can communicate that effectively and simply to my investors, that makes a big difference. So, and it also goes into your board minutes, and how are you going to raise the next round and some of those strategic thoughts. That's a lot of the corporate hygiene that I'll participate in. But on the other hand, as an entrepreneur, revenue is oxygen. So how are we doing generating that revenue? And am I doing enough as a strategic investor to get you that next customer? So
that's great. Thank you, Dennis.
Sure
And
thing.
thank you everyone for posting those questions. That's been really helpful just to kind of help guide the conversation. Appreciate everyone participating and attending and helping spread the word on opportunities with respect to digital health. Dennis, thank you again for being such a wonderful guest.
Yeah, what a pleasure, Michael. Thank you for asking me to join. I really appreciate it.
Absolutely. And we've got the Healthcare Pulse QR code back on the screen here. Feel free to take a quick picture of this. We'd love to have you join our Slack community if you're not already on it. Check it out. And again, thank you everyone for attending. Dennis, thank you again. Have a great weekend, everyone. Look forward to staying connected in the future.
All right.
Take care.
Thank you.
Bye.
Bye.